Hi, everyone. I'm Dr. Paul from the Eastern Ontario Health Unit, just to give you another update of where we are with COVID-19 in our area and beyond. I'm just going to share my screen as usual. We have been, keeping an eye on all the data. At this point, what we're looking at is hospitalizations, and they have gone up in our area. We have 16 in hospital at this point in time, 2 in the ICU. Again, lower than we had back in January, but still going upwards. More specifically, our percent positivity is stable at around 16%. It was the same like that last week. It's a bit lower than the provincial average. If we're looking at our hospitalizations overall, in terms of people testing positive, we're going up as well. And that's an indication more of community spread. And in terms of hospitalizations, again, we're sort of going up and down, but you can see we're on an upward trend, and in the ICU as well. So that's something we need to keep an eye on. Again, that's not unexpected, given that we've removed all restrictions. This just gives us a pattern of daily hospitalized cases back in January. So we're not at where we were then, but we are in a better position as well. However, we've got to keep an eye on that. And we're also seeing, obviously, the case numbers going up a bit, but starting to stabilize, as I'll show you a bit later. This is trends in our long-term outbreaks. Actually, this is an older slide, but now we're up to 10. So we're down. And then this just shows us, again, sadly, that most of the deaths have occurred in the elderly and among people who have had underlying medical conditions. And finally, our wastewater signal has been tapering off provincially as well. You can see here the province-wide wastewater signal here is starting to go down, which is good news. And if we look at it at the local level, you can see that Eastern as well, which compromises the area from all the way from this is Hastings, Belleville, actually, all the way to our area. You can see that there is a downward trend. We're also seeing a downward trend in most of Ontario, with the exception of North. But again, there is that downward trend, and we're trying to push that downward trend as quickly as possible, because the lower it goes, the less hospitalizations, the less admissions, and so on. And this just gives you an idea of the positivity provincially. And you can see that it increased as compared to March. It's going up a bit now. It's closer to 20%. Ours locally is about 16.5%, but there are some areas that are over 20-25%, still some hotspots in our areas. You can also see here the cases, and this is as of last week, actually as of the 17th, where we have 148 cases. That's a bit less than previous, and that's the weekly average per 100,000. And you can see there's a variety across the province, and mostly you could see, again, Kingston has the most cases per 100,000 per week. You can also see that most of the health units, including ours, show a slight upward trend, but kind of tapering off, as you could see, and there's just a few that are decreasing. So we are seeing a tendency to decrease the cases. Don't forget, this is as of last week, so we'll see. We get the results at the end of this week from the previous week. This shows us, this is an interesting graph that shows us basically the hotspots, the areas among the 30 regions, 30 sub regions. Our area is the Eastern Champlain region of the LHIN, and you could see that from April on, if you look at all the dates, we have gone overall down in terms of the 2 week the volumes that we've seen. So they're going down. Again, we're only testing certain people, but that gives us a trend as well. So that's another sign that we're trying to stabilize. And now we're going to talk a bit about vaccination, which again I think is one of the major reasons that we're not seeing as big a bump that we've had of cases that we had in January, that our vaccination rates are pretty high. 12 plus are over 90% first dose and second dose. Now our preoccupation really is looking at third dose. Again, we're stuck at that 60% mark. And again, the elderly, predominantly people over 60 here. We still have some work to do, predominantly 60 to 69, about 20% need to go. But overall, we're really recommending the third dose, because we do believe, and I'll show you a bit later, that there is much better protection with the 2 doses versus with the 3 doses versus the 2 doses. And this is the graph that really explains that. You can actually see that this is the vaccine effectiveness, how well the vaccine works in preventing hospitalizations and admissions and so on. And you could see that it's pretty good. After your second dose. And again, this is for Omicron. Don't forget the vaccine that we have now was designed for the original version of the COVID virus, and this has mutated a bit to be a bit more resistant to the vaccines. And so what we're seeing here is that after the second dose, you have pretty good coverage, about almost 80% here, but then it goes down, and then it goes down to about 30% 6 months later. And that's why we're telling people, particularly if they're over actually any age right now, if you're beyond 6 months of your second dose, please get your third dose, because the third dose really increases, and it lasts about 3 months, almost 90% effectiveness against hospitalization and admission, and within almost up to 6 months, you get 80%, much higher than you do with just 2 doses. So it's quite important that people please go and get your third dose when you're eligible. This is a very interesting one as well, because we have been seeing, and as I've said it time and time again, we've had what we call breakthrough cases. The vaccines, and particularly against Omicron, are not 100% effective in preventing illness. They do, however, at a very good rate, prevent hospitalization and severe disease, which is really our goal. However, a lot of people, are thinking, okay, what is second dose? If I break through with a second dose versus if I break through with a third dose. Breakthrough means you get infected despite the fact that you've got the vaccine. So if you had 2 doses of the vaccine, you're actually shedding, and this tells us how many viruses you have. So when you get infected, the virus reproduces in our respiratory system, and then we exhale it, right? That's how you spread it in the air, in aerosol drops and so on. But so we see that the 2 doses, even if when you get infected, you're spreading it. You have a lot of virus that you're shedding. And so people around you who are not protected fully will be exposed to you as a vaccinated person. However, if you have 3 doses, the amount of virus that you secrete or you disperse is much, much lower, and hence you will be less contagious to others. So this is quite important, and this is why we have different approaches for people that have 3 doses versus 2 doses if they've been infected, or if they've been in contact with somebody who has had it, or if they have symptoms. So that's very important. The other thing that we're seeing as well is that you've heard of long haul COVID, where we've got COVID, symptoms lasting, and other things, brain fog, heart problems, and so on, lasting for 6 months, a year. The good news is that there's a study that just came out recently that shows that for the most part, people who are vaccinated, even 1 dose or 2 doses, if they do get COVID, there is hardly any chance that they will be developing long COVID. So it seems that long COVID occurs mostly in people who have not been vaccinated at all. Hence, another reason to get vaccinated. Again, speaking of reasons to get vaccinated, you could see here, this is the science tables analysis that was released last week, which shows us that individuals who are not vaccinated, as a matter of fact, they make up over 60–70% of all hospitalized patients, by the way, right now. And you can also see at this point that if you are not vaccinated, you have a 4 times risk of getting hospitalized with COVID, and 6 times more likely to end up in the ICU if you're vaccinated versus not vaccinated. Again, our goal is to prevent hospitalization, ICU admission, and death, and that's very important, and that's what these vaccines have been doing. However, we need to ensure that we're up to date with those, and this just shows us again that although many ages get it, most of the ones that end up in hospital are 60 plus, and ICU are 60 plus, and deaths, and by far more against the non-vaccinated, more deaths and ICU admissions, hospitalizations occur among the non-vaccinated as compared to the vaccinated. This is just the thing I showed this to you last week. This says that most of our cases, or almost 70% of our deaths in our area, have occurred in non-vaccinated individuals, and that's sad. But again, it just shows you how the vaccine is effective. These are the models that came out that were modified last week based on new data that came out, and we have been expecting to have a 6th wave, but many of us did not expect it to be as high as a 5th wave, and the modeling shows that. And it depends on different scenarios. We can be as high in terms of hospitalizations, but they're not expected to be as high as they were in the fifth wave. And the more we, take care of the public health precautions, get vaccinated, get third dose, get fourth dose, the more that we do that, the closer we're going to be to the lower range of the peak of that curve, which seems that we're kind of there now. And what we want to do right now is, we're kind of like turning that curve. What we want to do is we want to push it down lower, 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 and then kind of it'll flatten out, and we'll have cases on and off, but very manageable as we move forward. So that's really our goal. That's both for ICU and hospitalizations for that. So again, one of the things that is very important to the sixth wave is really our goal is to blunt it. And I've said it time and time again, get your vaccination, get your fourth dose if you're eligible. Again, people over 60 years of age can get it 3 months or later after their third dose. One of the things that we have here right now is now we have Novavax, which is a vaccine that's non-mRNA. It's kind of a traditional technique that was used for vaccine production. And so if you don't want to get or can't get an mRNA vaccine, this is now for you. It is available in our area. We're continuing to wear a mask, obviously. I think it's very important over the next couple of weeks, really, to be able to keep the masks on, particularly in crowded places and so on, and obviously continue our public health measures. And finally, I did talk about it last week. Paxlovid is now becoming more and more available. This is, I think, a game changer. If you have underlying medical conditions, immunosuppressed, different age groups, and so on, and if you take that medication within the first couple of days, up to 5 days, after your symptom onset, these pills can help reduce hospitalization by at least 80–85%, sometimes even higher. And that's very important. And just to give you an idea, since we started the announcement, we're getting a bit of a pickup of Paxlovid. This is the number of Paxlovids that have been distributed, but that is going to only increase as we move forward. So that's very important. And finally, I just wanted to also say that I was looking at absenteeism in schools. We only have a couple of schools that have had more than 30% absenteeism, and provincially, it's a very small percentage of all schools that have had a high one, but we are keeping an eye on it. We are working with our schools, and we're making sure that all the precautions are in place in schools, and encouraging, again, parents to get their 5-year-olds and up vaccinated. We're only at 50%, and kids that are 12 to 17, we've had high second dose uptake. We're only less than 10% third dose, so please get your third dose as well, because that's going to provide all that immunity across the board. So that's it for now. Again, please get vaccinated. Please continue to follow the public health measures. Don't go out when you're sick, and wear the mask in indoor places. And we will reevaluate that over the next couple of weeks. And I think with the summer months, it'll get better. Thanks, and see you again next time.